This is a quick demo and overview of the charge capture workflow when you're using a hospital census list. So in order to do this, you'll go into your settings and you'll have a couple different accounts here. Mine is a bit busy because I have a lot of access to a lot of accounts, but you'll just have two different accounts here. You can name the usernames a little bit different and easier for you to see that one is your clinic view, one is your hospital view, and all you have to do is simply switch over from one to the other, and you'll notice that at the bottom here you'll have this stays indicator. That shows you that you're going to be in the hospital rounding. So once we get everything set up, instead of having a person here to select, you're going to have different departments or hospitals that you can select. You can see here that I have multiple selected. These are locations that we would work with you to set up, so you can have multiple or just one. So when you come in here for the first time, you just need to select the location that you're at and hit done, and then it's going to populate the names here. So you can see here that I have a list of all the patients for the departments and locations that I have here. You'll notice to the left of the name that you'll see some room numbers, department numbers. This can be configured on your implementation. You can also swipe over on the patient for more details, and you can see patient demographics, the attending, admitting, and care team. We can get those populated based on the ADT feed that we work with you on that. So that's kind of an overview there. You can also add folks to your stays list manually. So let's say you don't have the patient on the list. You can quickly come in here and you can add a new patient. So at the top of the screen, I can hit add. I can put their first name, last name. I can enter in the date of birth if I need to. And let me get out of here. You'll notice that I have already created a patient here. You'll notice that there's a little cell phone indicator to the left of it letting you know that that person was added from the device. So I can remove them whenever I do submit the charges there. So let's go into a patient now. So I'll go into Coleman, and there's not a lot to see here because you're just doing the ADT feed and you're just going to be entering the charges. So once you go in to enter the charge, you'll hit new charge. Anytime you've added a CPT code more than 3 times, it's going to append to your quick pick list down there. So I can add that. You'll notice that I can also change the date of service. So if I want to say this charge is for yesterday, I can add that. I'll click the 99213 there. And if I want to add one for today or another one to Wednesday, I can go ahead and do a search. So if we do 99217, search that, it's going to pull that up. I can put it in. You see it put it in for Thursday there. I can keep adding CPT codes. I can keep messing around with the dates of service if I want to, but I'll go ahead and be done. It'll give me an overview here, and I can hit next. And then from here, it's going to ask me to add a diagnosis. So I'll just go in. Again, if there are commonly used diagnoses that you've used more than 3 times, they will be here. But I'll just go ahead and put in COVID. We'll make a search, and this is going to use IMO in their diagnosis database. So I'll put COVID-19. It gives you a quick little overview of that diagnosis, and then I'll add it to that list. And then once I submit, it's going to show me all the charges that I've entered for this week. I can go ahead and click in here and review, minimize there, and that's basically it. So that is a quick and easy overview of how the charge capture works when you're doing an inpatient rounding workflow.